Hi, and welcome back. For any new people, my name is Tamika. I'm a nurse practitioner and holistic health and weight loss coach. I help obese and chronically ill individuals who are frustrated and confused by, their weight gain and increasing medication need and poor quality of life. I help them to improve their health and achieve sustainable weight loss through holistic diet and lifestyle changes. So, if this resonates with anyone, feel free to click the link in my bio to learn more about my services and how I can help you. So, for any of you that are following me, you know that I generally do my lives based on my most recent video. So I recently did a video about being 50 pounds overweight or more is a sign of chronic disease. And this might be a topic of contention for some people because, some people may say, well, I feel fine, I don't have disease. And the very nature of being 50 pounds overweight is disease. And so I just wanted to talk about that a little bit and some other topics surrounding that you guys might find helpful. And I currently work in GI, but I've been a nurse practitioner for 10 years now, and I've been in healthcare since 2006. I was obviously a nurse, not obviously, but I was a nurse prior to being a nurse practitioner. And so I've dealt with chronic disease and obesity for many years through various specialties and just work in general. So I have realized that when it comes to chronic illness, people might think that they feel fine, but it could be a couple of things. One is that maybe you get used to the symptoms that you were having of disease, and or you may not think that having symptoms equates disease. Okay, I have some joint pain, but I'm otherwise fine. That's a sign of disease. I have mental fogginess, I feel fatigued, I have poor sleep, I'm winded when I take the stairs. These are some of the things I mentioned in the video, I think. But the point is that symptoms are a sign of disease, especially if these are symptoms that have been going on for about 3 months or longer, that would be considered chronic. And so these are a sign of disease. And if you're experiencing these things, that is disease. But some people may get used to it and it's kind of a part of them. They don't realize that they feel stiff in the morning and they have some backaches or joint pain when they're getting out of bed. Or once again, when you take the stairs, you're kind of winded. You think that's, you know, par for the course. That's what happens to everyone. It's not actually. And so if you're 50 pounds overweight, once again, whether you're having symptoms or not, that's actually disease. And so, you, some people may subscribe to the healthy at every size. And I just want to comment on that. But before I get into that, I do want to say me saying that obesity is disease is not trying to insult anyone in regards to your appearance or your character. It doesn't mean you're a bad person. It doesn't mean that you're hated or deserve to be, a victim of anything. You know, so obesity as a disease is just like saying diabetes is a disease. It's like saying heart disease is obviously disease, or having a stroke is because of disease. Obesity is the same thing. It is because of disease, and it is a sign of disease. So it doesn't mean that you're any less of a person because you're obese. So I just want to make that clear. That's not what I'm trying to imply. Now, when it comes to healthy at every size, I would agree that there is quite a range of weights that could be considered healthy. And healthy doesn't mean you need to be rail thin, right? Um, healthy could be a variety of weights, but healthy, healthy is a range. Not health and disease is a spectrum, and there's nobody who's 100% healthy. And if you're 100% diseased, you're essentially not alive, right? So we all fall on this spectrum and can move up and down in this spectrum over the course of our lives. So when it comes to healthy at every size, there is an upper limit, but there's also a lower limit. So even though I'm not focused on the lower limit, because that's not, even though I do see people who are underweight, I would say roughly BMI of 16 or less would be considered underweight. And I would say that would be associated with disease. There's an upper limit. So I'm focused on the upper limit of the BMI greater than 35. So anything between roughly 16 to 35 could technically be healthy. If you're otherwise feeling fine, you're not having any chronic persistent symptoms, and you're otherwise doing well. Whether you choose to do studies, to look at abnormal laboratory markers or imaging studies, that's up to you. That's a whole nother conversation. But if you otherwise feel fine and you're not on medications and you have no official diagnoses, anywhere between 16, a BMI of 16 and 35, you could be considered healthy. So for any of you guys who are listening, and if anything resonates with you, please go and check out my bio, or like and follow and comment. I'm always open to a conversation if you guys have any thoughts about what I'm saying. So feel free to leave comments, ask questions, or whatever you like. So with that being said, healthy at every size. BMI between 16 and 35. I know this sounds like a very wide range, but I think that even on the upper end, if you are feeling fine, if you have a good quality of life and you're functioning well, you could still be healthy potentially with a BMI between 30 and 35. Beyond 35, you're looking at about 50 pounds overweight. You're not going to be healthy at that level, even if you don't have symptoms. If you don't have symptoms, once again, it could be one of two things. It can be you've just gotten used to the symptoms you were having, so you don't even recognize them anymore, and that's actually quite common. Once again, I'm a nurse practitioner. I'm actively practicing as a nurse practitioner. And when I interview patients and we have a conversation about their symptoms, as I dig into, thank you very much for the likes, I appreciate you. As I dig in further with questioning, I help them to uncover the fact that they are having symptoms, even if it's like they don't even realize it's a problem. I work in gastroenterology, which is, GI gut health. And they may come in with chronic acid reflux, which is a common complaint. But because I'm thorough, I do ask questions about other potential symptoms. How often are you having bowel movements? Oh, I go once or twice a week. And they don't even skip a beat. They think it's not a big deal. It's like, okay, well, okay, you're constipated, and actually that might be common, but it's not normal. So how about we talk about that as well? So you see, people can have symptoms and they get so used to it, and it's like, well, I've been doing that, I've been like that all my life, so they think it's not a problem. But it actually is, whether you're used to it or not. Or I have chronic bloating, I'm excessively gassy and things like that. So this is just an example of symptoms that people can have, and they just kind of get used to it and not really think much of it. But it is, once again, a sign of disease. So what is my point? You have a BMI greater than 35, you're 50 pounds overweight. Whether you notice your symptoms or not, you are diseased. Okay. And okay, so let's say you don't have any noticeable symptoms. Whether you recognize disease or not, being over 50 pounds above normal body weight, you there's a lot of things going on. For one is that you have abnormal hormonal profiles. You have abnormal sex hormones for sure. You're going to have abnormal thyroid hormones. You're going to have abnormal various metabolic hormones, right? Your insulin and your ghrelin and all of your hunger and satiety hormones, your insulin, all of those things are going to be abnormal. And so being over 50 pounds in excess body weight is going to create an abnormal metabolic profile, period. Okay, so that's one thing. The second thing is you're almost guaranteed to have visceral fat. And granted, the skinny fat exists. And so let me just comment on that. What I'm saying doesn't mean that you have to be overweight to have disease. Clearly, thin people or normal weight people have disease. I see it all the time. So I'm not saying that, if you're normal weight, you're good and you have nothing to worry about. Only if you're overweight, you're diseased. That's not what I'm saying at all. But what I am saying is if you're 50 pounds overweight, you certainly have disease. So, okay. So now you have visceral fat. Visceral fat means that you have fat around your organs. If you have fat around your organs, then they are not going to function optimally. Any new people, once again, my name is Tamika. I'm a nurse practitioner and holistic health and wellness coach. And today I'm talking about obese individuals who are 50 pounds overweight or more, and that they are chronically ill, whether they have symptoms or a diagnosis or not. Okay, so that's what today's conversation about. Please check out my bio, like and subscribe and comment and do whatever else you think would be helpful. But that's what we're talking about today. So if this resonates with any of you, if you're obese, whether and 50 pounds overweight, whether you're having symptoms or not, you are chronically ill. And your goal doesn't have to be to lose weight specifically, but making healthy diet and lifestyle changes can help to improve and preserve your health. So you do want to prioritize that because you are sick. Whether you want to accept that or not, I'm telling you. And I'm telling you as a friend, and I'm telling you because I care about you. And this is what I do. And I help people who are chronically ill and who are obese improve their symptoms of chronic disease, reduce their dependence on the healthcare system and medication, and achieve healthy, sustainable weight loss through holistic diet and lifestyle practices. If you click the link in my bio, you can schedule a free consultation to talk about your problems and find out if my program is good for you. Okay? So, if you have visceral fat, then the organs are not going to work properly, period. Okay, I'm going to keep this simple. I'm not here to speak scholarly or with a lot of medical jargon and such. I'm just going to get straight to the point and keep it simple so that we're all on the same page and everybody has a good understanding of what I'm saying. If you have fat around your organs, the organs in obviously the chest and abdomen, your heart, even your lungs, your liver, your pancreas, all of the organs, your kidneys, everything. If you have fat surrounding all of those organs, the function will be impaired, period. And if the organ functioning is impaired, then that will result in disease. You're going to eventually have reduced organ function. And even if you feel fine now, it's only a matter of time before you start having symptoms. Or what's even worse is that, and you often see this with liver disease, you don't have symptoms until you're in advanced stages of liver disease. And so people think they're fine, and then all of a sudden, they go in, I don't know, maybe for a routine visit with their primary care. They get some routine labs and their liver enzymes are elevated, and it's like, oh, what's going on here? and they find out that they have some sort of disease process, or they're having symptoms. Now I have yellowing of the skin or eyes, and my abdomen is full of fluid, and I'm having, fluid retention in my extremities, and I'm having all these symptoms. You go in to see your primary care and you're in liver failure. Well, how did that happen? I felt fine prior to that. You might have felt fine. I use a lot of air quotes here. You might have felt fine, but disease was in progress. Listen, let me make something clear to you guys, whoever's still listening. By the time you have symptoms, you already were developing disease for months, possibly years, prior to you having symptoms. Okay? When you have symptoms, it's never okay. Let's say you have symptoms on a Tuesday. You didn't start having a disease on Tuesday. You probably were having disease months or years prior to that. You just noticed it on Tuesday. Your body started to send you obvious signs on Tuesday. So that's just an example. When you start to have symptoms, you've already dropped the ball. You're already behind the power curve, okay? And things have been going on, abnormalities have been going on for quite some time, but your body was doing its best to balance things out and maintain equilibrium and keep you alive and help you to function. Maybe you were having a little more fatigue, a little more aches and pains, a little more brain fog. Your sleep wasn't as well. Maybe you were getting up more often throughout the night. Whatever. A little bit more headaches and dizziness and blurry vision. These are just examples. But the point is that when you started to have symptoms is not when the disease process started. It was already going on for months or years prior to that. So just the FYI on that, guys, because I get people, they come in and say, "Well, I was fine until, Sunday and I started having symptoms." No, you weren't. You weren't fine. You just started noticing symptoms on Sunday. So just FYI. um and once again, if you go and look at any of my other videos, and I harp on, my standard recommendations of healthy diet and lifestyle: meat, eggs, fruits, and vegetables, that is a healthy diet. And I go over a variety of other lifestyle changes that can help improve your health, and these things can help to support healing of the mind and body, and improve your health overall, and help to improve diseases or completely reverse diseases in frequently, actually, not just in some cases, frequently. Okay, what was I talking about? 50 pounds overweight, you have disease, you're chronically ill. um and so thanks, guys, for any of you who are still listening. I appreciate you guys. And once again, my name is Tamika. I'm a nurse practitioner and holistic health and wellness coach. Click the link in my bio if you want to learn more about how I can help you if you're 50 pounds overweight or more with chronic illness. How, you can never be too overweight or too sick to see improvement with healthy diet and lifestyle changes. So don't give up. Get help, whether it's from me or someone else. You can always improve your situation with healthy diet and lifestyle changes. Okay, so I said you have abnormal metabolic profile when you have visceral fat, that's fat around all of your organs, that will impair organ function. These are things that occur with being 50 pounds overweight or more. The next thing is abnormal immune function. If you're more than 50 pounds overweight, your immune function will be abnormal, and you will have abnormal inflammation. You will have maybe early autoimmune activity of the immune system, where you're, thank you very much, Iris, thank you, I appreciate your thanks. um and so if you have when you're 50 pounds overweight or more, you can have early autoimmune behavior, where your immune system starts to target various organs and attack in an abnormal fashion. And, they say, well, nobody knows why autoimmune disease occurs. And It's generally a multifactorial problem. Just like everything else I literally just said in regards to having symptoms, it didn't just start. Autoimmune disease doesn't just start out of nowhere. This is something that has been building up over months and years. Chronic stress, poor dietary practices where you're eating a lot of processed foods, and processed foods creates inflammation in the body. That's stressful for the body. And that's like most Americans. Yes, Phantom, I agree. That's you're absolutely right, and that's why we're in a health crisis now. So you're absolutely right. Thank you very much for commenting. So and so all of these things are happening prior to autoimmunity being detected through labs, imaging, and you're having symptoms. Remember, once again, you started having symptoms on Thursday. I'm going to pick a different day of the week every time. That's not when autoimmune disease started. You were having autoimmune issues prior to that. That's just when you went and had labs and it showed some, abnormal markers, whatever. The point is that if you're 50 pounds overweight or more, you are likely to have abnormal immune function. So you have abnormal inflammation in the body, and that's where you may have your joint pain, your other aches and pains, your mental fogginess, and some of these other symptoms. Or you start to have other, diagnoses. Oh, I keep getting UTIs. I get chronic kidney and, I have recurrent kidney infection, let's say. And it's like you may think that has nothing to do with, me being 50 pounds overweight, me being obese. It does actually. It does. It does. It has a lot to do with that because the obesity will contribute to abnormal immune function. And if your immune system is not functioning optimally, then you are likely to have recurrent infections and problems with inflammation in various forms. So, that's just another example of how you can have diseases going on even if you don't have symptoms specifically that you would associate with your weight. So I talked about things like joint pain, and I know let me say something else real quick. When people who are 50 pounds overweight, and I know it kind of sounds like an arbitrary number, but when I went and started looking at the BMIs, and I know BMI isn't a great marker, but when you start getting in the very high and very low BMIs, they it's actually helpful. It is a helpful marker. I know that when people are very overweight and they go in to see healthcare providers, and once again, I'm an active provider. Sorry, I'm just trying to straighten my thing out here. I'm actively practicing, and I hear this quite often. They are often discriminated, and I completely agree with them. They are. I know they are. I do agree with that, and it's unfortunate, and I'm sorry that this happened. And that's not what I'm saying in any way. Once again, as I mentioned, being overweight doesn't mean that you're any less of a person. And I'm not trying to attack anyone's appearance or character by any means. It's just like if I was talking about diabetes, high blood pressure, heart disease, things like that. So it's just kind of matter of fact. There's nothing personal here. But I do know that when people go to see their healthcare providers, depending on what your complaint is, oftentimes they will say it's because you're overweight, go and lose weight. Now, they're not wrong, but they're not right. And so people shouldn't be made to feel like, they're any less of a person because they're overweight. And I know that's often how people feel when they go see their healthcare provider, because when they come to see me and I actually listen to them, and I give them plenty of time to talk about what they're experiencing and their symptoms, and we go through all of these things. That's one complaint that they give, that you know whenever that they know they need to lose weight, and everybody tells them that, but they feel like something else is wrong, something else is going on. So even though I might do diet and lifestyle counseling to help improve their weight, I still do a thorough evaluation. I don't just say, "Oh yeah, it's your weight. Go, lose weight and you'll be fine." I still make sure I still evaluate for other potential causes of their symptoms. But will their weight have an impact on that? Yes, it will. So these are things to just be mindful of. Once again, being 50 pounds overweight or more, whether you're having symptoms or not, and having symptoms, even that needs to be discussed further because people get used to symptoms over time and they think they're fine because they don't notice the symptoms anymore, but they actually are not in good health and actually doing quite poorly. They just got used to it. The point is, if you're 50 pounds overweight or more, there is a disease process in play. The very act of being that overweight is disease. Whether you have an official diagnosis like diabetes or heart disease or, neurologic diseases or whatever, whether you're on medication or whether you have abnormal laboratory markers or imaging, you're diseased. And people would agree oftentimes that they feel terrible, and I get this often. They're having all these symptoms, but then when they go do testing, everything comes back normal. And people are very frustrated by this because they don't feel like they're validated. But it's like, well, something's going on. Why do I feel terrible, but all of my numbers are normal and my imaging studies are normal? The point that I'm making is that you see, you can't just rely on that. So just like you feel terrible and they're normal, you can feel fine and they could be normal, but there could be still be disease process going on. Or you can be fine and your labs are abnormal, and that's a sign that there's disease processes going on. The point is that if you're 50 pounds overweight or more, there is disease. So why am I bringing this up? You need to address this. It's not enough to just say, well, yeah, I might be overweight, but I feel fine, so it's not a big deal. That's not true. It is a big deal. Um, so you may not have a goal of weight loss, and that's okay if you don't care about losing weight, but you should care about improving your health. But guess what? If you make healthy diet and lifestyle changes, you will naturally lose weight, whether that was your intention or not. Because as you support your body in the healing process, various abnormalities will be normalized over time. Your body starts to heal, your immune system starts to function normally, and you have reduced inflammation. And over time, your organs and the fat surrounding your organs will decrease when you eliminate processed foods and other lifestyle factors that can contribute to poor health. And before you know it, you're going to start losing weight, and you're like, well, I never intended to lose weight, but that is a natural part of the healing process if you're excessively overweight. So what I'm saying is excess weight is a symptom of disease, just like headaches are a symptom of disease, just like, I don't know, diarrhea or constipation is a symptom of disease. Just like fatigue is a symptom of disease, even if you don't have an official diagnosis, these are symptoms of a diseased body. So when you start to support your body's natural mechanisms for healing through holistic diet and lifestyle changes, just like you will see your blood sugars normalizing, your blood pressure normalizing, your weight will normalize as well. So even if you are not self-conscious, and that's perfectly fine, and you feel satisfied with your appearance, in regards to weight, that's perfectly fine. But you will find that when you make healthy diet and lifestyle changes, you will lose weight. And that's part of my one of the mantras that I teach my clients is get healthy to lose weight. For those individuals who want to lose weight, who have a goal of weight loss, the problem that we often face is they are willing to lose weight at any cost. And in doing so, they often worsen their health in the process. So, what I focus on is improving your health, and in doing so, you will lose weight. So, I just wanted to talk about that a little bit today. Once again, if this resonates with you guys, like, my page, follow, and go see some of my other videos. Share my videos with people that you think would benefit from what I'm saying. I help, chronically ill and overweight, obese, really, not just overweight, because the BMI for overweight is like 26 to 30, and even 30 to 35 I think is kind of a gray area. But once you have a BMI greater than 35, all bets are off. For sure, you're chronically ill. Period. I have a strong stand at that point, regardless if you think you feel fine or not. So if you have 50 pounds or more of excess body weight, or you have a BMI greater than 35, whether you're having symptoms or not, if you want to prioritize your health, click the link in my bio and learn about how you can make healthy diet and lifestyle changes to improve your health. I offer a free consultation to dig into your problems a little deeper, to find out if my program would be a good fit for you. So feel free to go and check that out. But thank you guys for joining. I don't know how long I've been on now, but it was good talking to you. Thank you for the likes and the shares, and go and follow my page if you find that this kind of information is beneficial to you. If this resonates to you, if you're 50 pounds overweight or more, and you're having chronic symptoms or not, but you would like to investigate how you can improve your health, go check out what I have to offer. So, you guys have a good rest of your night. Thanks for joining. Take care.